The Democratic Republic of Congo is dealing with 3 medical emergencies at once. There's the coronavirus, the Ebola and outbreak of measles. Now, the coronavirus has registered only 10,000 cases, which is remarkably low for such a large country of about 90 million people. Still, it remains a major concern for many.
Cet effet coronavirus risque de couper mes rêves d'aller à l'université l'année prochaine, voulais-je dire.
Et à cause de Corona, je ne vais pas à l'école. Parfois, pendant cette situation, je me sens comme un prisonnier.
Freelance photographer and filmmaker Thomas Nybo has just returned to the United States from Congo. He's with us from Atlanta. Hey, Thomas, thanks for taking the time. Yeah, it's incredible when you look at the timeline here, what's actually happening at the DRC. Since early last year, the country's been dealing with the world's biggest epidemic of measles. Then in March, the coronavirus was detected. By June, what was the world's second biggest outbreak of Ebola officially came to an end, but that was followed by another Ebola outbreak just last month. This is one of the poorest countries in the world. They're facing 3 separate health emergencies, but that experience with Ebola is actually kind of paying off when it comes to the coronavirus, right?
It really is, because the people are used to following a certain protocol, hand washing. They understand how germs are spread. And as you know, the fatality rate of Ebola is much higher than COVID. So what I experienced on the streets every day, spending hours amongst the people over the past 6 months, was they didn't really see COVID-19 as a big threat. You compare it to Ebola, which of course gets the headlines, and the world's worst measles outbreak in the Congo, which killed more than 5,000 kids under the age of 5 last year. And you look at the small number of deaths, 260 by last count, by COVID-19. So yes, Ebola has, in a sense, prepared them for this pandemic.
The interesting thing too, you mentioned the children, because they're often spared the worst of the coronavirus. But when it comes to the measles, it's taking a really huge toll on these kids under 5. I think the death rate is 9 out of 10?
It's unbelievable. And as I said, it's the worst in the world. And what happens too, if resources are diverted to fight Ebola or to fight COVID, then vaccination campaigns can be halted in their steps. And what also has happened, as I witnessed with COVID, a lot of different agencies fled the country when the pandemic kicked in, which of course raises the possibility for measles to get even worse. And as you saw from the 2 kids that appeared at the start of this segment, what I really appreciate about what UNICEF is doing is focusing on the children, not just the physical threat posed by COVID, but the opportunity cost. What is lost by keeping them out of school? And one of the programs that I really like to see and that I was proud of was a radio program that was broadcasting lessons to millions of children across the country as the country dealt with measles, with Ebola, and with COVID.
Yeah, those numbers though for the coronavirus seem incredibly low, and obviously there's some doubt if that's what the real numbers are, because there is this lack of testing. So what are they looking at here? What's the reality? Do they know?
The reality is it's hard to say. I look at the deaths, 260, which is also remarkably low. It's the deaths in the United States are more than 700 times greater. So what I was thinking was, oh, there's just not enough testing. Well, testing has been ramped up, and I'm on the streets every day. I was on the streets every day talking to people, and people weren't dying of COVID, certainly not in the East. Most of the cases are in the West, in Kinshasa, where I was not. I think what you also have to recognize is the median age of someone in the Congo is 17. Compare that to the United States, where it's 38. And young people are escaped generally the worst of COVID-19, so that also plays a factor.
Also seems that because of the Ebola experience or whatever it is, they're a lot more proactive. You have to get like a COVID-19 test before you get on your flight from traveling overseas. They test you when you get to the airport. They ask you a bunch of questions. They don't do any of that stuff when you come to the US. You get to the hotel, you get sprayed with disinfectant, and your temperature's taken. And there's a level of vigilance, I guess, for the very basic, easy stuff, which isn't happening in many of the advanced countries like the United States.
I have to give it to the government of the Congo. In the early days of the pandemic, I arrived the first week of March. They shut down the borders, they shut down the businesses, they shut down commercial air traffic, they shut down commercial boat traffic across Lake Kivu. And that's a great thing because it's almost impossible to do social distancing in a city like Goma, where I was based. You have a dozen people or more crammed into public transport. People don't have the luxury of just holing up at home and, ordering out. They need to work every day. They might have 1, 2, 3 days worth of food if they're lucky.
Yeah. Yeah, it's tough, but at least it's amazing how a lot of these countries in Africa have done such a better job of dealing with this pandemic than, the Western nations. But Thomas, we appreciate your reporting. We appreciate you going there. Thank you.
Thank you, John.